I can't even imagine why we would give them this and then take it away.
Virtual visits to your doctor have become a huge hit during COVID, but now face an uncertain future.
During this pandemic, patients have had unprecedented access to health care without leaving their homes.
But tonight in a special report, Sally Schulze tells us why the clock is ticking for telehealth as pressure mounts to change state law.
Hi, are you Adam?
Dr. Meeta Shah can shed the mask and talk face-to-face to a patient through a computer screen.
We can finally show our emotions again to our patients. I think we've lost that human connection behind the mask.
This emergency medicine physician at Rush University Medical Center helped launch Rush On Demand, where patients can book video visits.
They have a lunch break at noon, or they have a break, during work, and they can hop onto their screens and see their doctors.
Rush started offering telehealth in 2019, but it exploded during the pandemic, going from an average of 67 telehealth visits per month to 21,000 per month when COVID kept patients home.
Patients were finally able to use their insurance to do visits using telehealth, and that really kind of changed the game.
This was the game changer, an executive order Governor Pritzker signed in March of 2020 and keeps extending. It basically forces insurance companies to pay for telehealth visits like in-person visits. But what happens to telehealth when the pandemic ends? Representative Deb Conroy has a plan.
This legislation will allow us all to access it and for insurance to pay for it.
The Villa Park Democrats sponsored legislation to make telehealth a permanent option. She says one big struggle is that insurers are willing to reimburse mental health visits the same whether virtual or in person, but not visits for physical health.
I've spent years fighting for mental health parity payment. And now all of a sudden we're fighting for physical health parity payment. And it's like, come on, this is, our bodies don't function without our brains, and we got to bring this all together.
Telehealth services, not only that it's important, it is an expectation.
The chief strategist officer at Rush University System for Health says telehealth is not just key to the pandemic, but to the future.
We expect by 2025, 75% of our consumers, our patients at Rush, will be millennials. Their expectations of how they receive care is via digital, via telehealth.
And for Dr. Shaw, she can't imagine stopping these virtual visits. She says it's not just COVID keeping people away from care, but lack of time, transportation, and proximity to a place like Rush or any other hospital.
What happens when they don't have any access? They can't physically come into us. Well, then they just stay home and get sicker.
The legislation to make insurers cover telehealth has passed the Illinois House. It's now being negotiated on the Senate side. There is a time crunch here because the governor's executive order on this will expire when the state is set to reopen June 11th. Sally Schulze, Fox 32 News.